Hello, I am Abigail Wentz, an EVMS radiology resident. Along with faculty member Dr. Mitchell Wangsgaard, I have written this poster entitled Neuroimaging Findings in a Patient with 22q11.2 Deletion Syndrome. 22q11.2 deletion syndrome, DS, also known as DeGeorge syndrome, is a common genetic disorder affecting approximately 1 in 4,000. It is a phenotypically heterogeneous disorder with some of the more characteristic features including cardiac abnormalities, thymic hypoplasia, and palatal abnormalities. Additionally, there are neuroimaging findings that are commonly associated with 22q11.2 DS, including cavum septum pellucidum and white matter changes. There is some research to suggest that this specific combination of neuroimaging findings is associated with psychosis in patients with 22q11.2 DS. This patient is a 33-year-old woman with 22q11.2 DS and a past medical history of seizure disorder and psychiatric disorder with psychotic features, who presented to the emergency department after developing acute monocular transient vision loss. Her physical exam was unremarkable. She underwent head CT, which showed moderate periventricular and subcortical white matter hypointensities and a CSP. Follow-up MRI confirmed extensive T2 flare white matter hyperintensities and CSP with no acute changes. The acute vision loss was subsequently diagnosed as ocular migraine. Comparison with prior neuroimaging studies that were performed the prior year, as well as imaging studies conducted 14 and 18 years prior at the patient's age of 19 and 16, demonstrated the existence and long-term stability of the white matter abnormalities. (22q11.2 DS is associated with a higher number of incidental findings on neuroimaging, including CSP and white matter abnormalities when compared to neuroimaging from individuals without the syndrome. Additional common neuroimaging findings in 22q11.2 DS not seen in this patient include global volume loss, middle and inner ear abnormalities, and gyration abnormalities. CSP is a normal anatomic structure present prenatally, which fuses in most individuals during infancy. Persistent PSP into adulthood is thought to be related to abnormal development of midline structures. In addition to 22q11.2 DS, CSP is a common imaging finding in patients with schizophrenia spectrum disorders. White matter abnormalities are incompletely understood and a nonspecific radiologic finding. They are thought to be related to axonal loss, demyelination, or gliosis. In the general population, white matter abnormalities become more common with age, secondary to microvascular ischemia. The pathophysiology of white matter changes in patients with 22q11.2 DS is not understood. In this patient, the white matter changes were evident as young as age 16. The constellation of CSP and white matter abnormalities in patients with 22q11.2 DS has been found in increased prevalence in patients with comorbid psychosis. The association is strong enough that Schmidt et al. In 2014 suggests that CSP and white matter abnormalities may be biomarkers for psychosis in the 22q11.2 DS population. CSP and white matter changes are among the common incidental neuroimaging findings in patients with 22q11.2 DS. Though the pathophysiology of these findings remains unclear, there is an increased incidence of these findings in patients with psychosis and 22q11.2 DS. This case highlights a patient with 22q11.2 DS, long-term findings of white matter abnormalities in CSP, and a diagnosis of schizoaffective disorder.